Next, I'm going to ask Dr. Pat Gabbe to join me up here at the podium. Dr. Gabbe is a clinical professor of pediatrics at Nationwide Children's Hospital and the senior medical director of the Ohio State University Health Plans. And she's the founder and director of Moms to Be Ohio and is the principal investigator with Nationwide Children's Center for Perinatal Research. Dr. Gabbe, thank you.
Thank you, and thank you all for being here. And I really want to thank Senator Jones and DiRossi for traveling clear across the state to highlight this really critical, important issue. As you see here on the posters, Ohio ranks 48th out of the 50 states for infant mortality. So they have brought forward a package of bills to address this. One of the packages that we're discussing today, Senate Bill 279, addresses prenatal care. It's a tragedy that our major cities, Cleveland, Columbus, Cincinnati, have 8% of the women who are pregnant either have no prenatal care or come in late. So it's a huge problem throughout our state that women are not getting to prenatal care early enough to help make a difference in this. And that's one of the reasons why we have such a high infant mortality. Women living in poverty, especially African Americans, are doubly affected. The African American preterm birth rate, infant mortality rate are 2 and 3 times that of a white woman. And our cities, Cleveland, Columbus, Cincinnati, have infant mortality rates more than twice that of New York City. Just think of that. New York City has a much better place to be pregnant and have a baby than our major cities in this beautiful state. Why is this? You know, we know our moms have more hypertension, they have more anemia, they have more medical problems when they do get pregnant. They come into their pregnancies not in optimal health. They lack food. We have 80% of our moms and moms-to-be have food insecurity, and that's at a time when they're becoming pregnant and trying to raise a healthy baby. Senator Jones and DiRossi highlighted the work we do at Moms to Be when they travel throughout the state. And I want to just briefly tell you a little bit about Moms to Be and why centering will help this model. We started in 2010 in an African-American church basement cooking for African-American women living in Wyman Park. It's a high poverty, high-risk neighborhood with as many as 2 babies dying there every year, and as many as 20% born preterm before they should have been delivered at 9 months. And we had strong community support in Wyman Park. We've met there every week for the last 4 years, and we have learned so much from these very resilient women. We've learned how, despite all odds, they do have healthy babies and they do want to eat right, go to prenatal visits, do the right thing to have a healthy baby, but so many barriers they face. We now will be in 4 centers. We're at Wyman Park, we're at OSU East in the auditorium, we're at Mount Carmel West, and July 15th we will be in the Columbus Neighborhood Health Center that Tom Horan will tell you about, where we will be working in FQHC, a federally qualified clinic, to start Moms to Be. So why do we need centering? Here in our audience is Lori McLeod, who is a midwife who comes to Moms to Be every week and also teaches centering. So centering pregnancy provides the clinical piece to the prenatal care that we do not do right now in Moms to Be. Lori can tell you a little more, and also you heard Nancy talk about what does centering do. It's an empowering way in a group to help women check their own blood pressure, check their own weight, know their numbers, know what it means to be anemic, know what it means not to have support. The group model that we have in Moms to Be and that we have in Centering is very empowering. Helps moms want to breastfeed and gives them the support. Helps mom see ways out of poverty. And it also helps with safe spacing, another really important message that we give our moms in Moms to Be and in Centering. Rapid repeat births is one of the contributors to our high infant mortality rate here in Ohio. All these group models that we're talking about are empowering and help moms see a brighter future and ways to overcome those barriers to health care. So, just to end, we've enrolled over 350 women in our Moms to Be program. We've significantly reduced the number of low birth weight babies they deliver. We have, on average, about 20 moms per session, and I invite any of you to come and see. We need volunteers, we need help, we need the whole community to come together if we're going to, as I say, resurrect Ohio. We have to get out of the worst of the worst. We need to be the best of the best because this is a beautiful state. We have the resources, we have the knowledge, we have incredible healthcare systems. Now we need the community support, we need the social support, and this bill, Senate Bill 279, will help. It'll be one little piece in the puzzle that we need to put together to help all Ohioans, especially those living in poverty and living in our cities, and in some of the rural areas too, which this bill will help. So, thank you very much.